Say was that radon at extremely high levels is showing up in the water because you didn't test it. So don't rule that out. We had radon levels of 2,000 to 6,000 in the water. So please don't ignore that. Okay. My final comment is in 1994, an affluent community in South Miami, 1,200 homes were contaminated by chlorinated solvents from dry cleaners. Within 1 year, the state had them on city water, period. Bond issued, they got them on city water immediately.
Hi, I want to say hi to the representatives. No, that's not what you want to hear. What you want to hear from people up here is that I'm Shelley Vanna, County Commissioner. What we want to hear from people here is that you from the state are going to help us through this. Because these people, whether they are frightened because their children might be sickened, or they're frightened because economically they're going to be devastated, we need help on both of those issues, and we need the help now. We actually need it yesterday. So when you go back, whoever you have to talk to, that is the highest level, we need to have an answer from you about how we deal with this whole scenario in real time. I think this is a bigger issue than local, but it's going to have to involve all of us. And I appreciate very much the folks who are up there. I have worked with these men, and they care about what happens to you. So please go across the hall now, or wherever you have to go, and talk with the people who can help us tomorrow. Not in 5 years or 10 years. And whether or not people are at risk, we have to have a plan for putting parents' minds to rest that their children are all right. And if that means screening them, so be it. But from what is happening now, people can't go on with this kind of fear in their lives. We have to screen the kids, not because we think they're all sick, but to make people understand that they're not if they're not. And then we have to figure out what's going on. We need your help now.
My name is Michelle McGovern. I'm Senator Nelson's regional director here. And my question to you is this. Have you reached out to the experts, not necessarily the government experts, but university and scientific experts in the field to take you to the next level? As we understand it, the CDC guidelines say that for phase 3 of this study involves outside expertise on this issue. Who have you reached out to, or will you reach out to, the top experts in this field in order to help find these answers?
Dr. Clemens.
The Center for Disease Control are coming next week to Tallahassee to address this issue, to provide us with guidance. They are the federal experts who can then connect us with those people, the National Institute of Health as well, and National Cancer Institute. They are connected to the network of researchers who either are doing studies that have not yet been published. We've reached out to the National Cancer Institute for that purpose, the National Institute of Health, to see to scan the country and help us to determine if there's any other areas that are addressing this or can provide us with guidance. So that is the means that we have to start to to reach out to the universities, the teaching hospitals, et cetera, where the research is ongoing. So that is a process that is occurring now.
Thank you. On the, right, there you go.
You know, I just want to speak for all of the residents in the Acreage. I also have a home in the Acreage, which I left, and I am so mortified, dumbfounded the way it's so played down. There are so many adults that are sick with cancer. You all talk about pediatrics, and we feel for those children. We feel for them. But why is it so minimized? Why is it such a small thing? I haven't heard one person talk about all the adults that are sick. We left. I got a CAT scan because I was sick. We left. We had the option to leave. So many families don't have the option to leave. We look at your blank faces. You all look so sad and mortified. Nobody has an answer. Well, I did a little research on my own that maybe a lot of people don't know. I don't know how legitimate, I'm not a big computer person, but I went to MapMaker, cancer cluster victims, and I was mortified. I'm just going to go very fast what I found with all the little red dots with all the updates. And most of them were not children. I'm going to say child by child. The others are just, if I say one or two, those are adults. Hamlin, one child. Below Hamlin, on 88th place, 1. 86th Road, 2. 83rd Place North, 1. 85th Road, 1. Citrus Grove Boulevard, 2. Mind you, I excluded the lung cancer, uterine cancer, ovarian cancer, all of those. These are only lymphoma and brain cancers, okay, that nobody is talking about. You with your sad little faces are not talking about, okay? 77th Place North, 1. 75th Lane North, 2. 76th Place North, 1. I'm shaking like a leaf even saying this to everybody. 76th Road North. 2 children also on 76th Road North. Key Lime Road, 1. 73rd Court North, 1. This goes on, and this was only a quarter because it took me an hour and a half and I thought I was going to faint looking at all this. 73rd Street North, 1. 83rd Place North, 2. Orange Boulevard, 2. Loxahatchee Grown, a child with a brain tumor, age 7, already died. Off Royal Palm Boulevard, 4. 40th Street North Road, 2. 40th Lane North, 3. 46th Court North. And it goes on and on and on. And they want me to be quiet, but my point is, we're asking these lovely officials questions, and I believe they do not have the answers. You have to seek counsel, and they're the ones that will test our water. They'll tell us the right things to do. They will help the people like myself who had to flee, that are worrying about our home and our real estate and our health and our lives. And God willing, if anybody leaves, you leave with your health intact. That's all I can say.
Wait, you didn't answer it. Why aren't you addressing the adults? She just went down the list. Excuse me, I'm sorry to skip. I just want to say one thing. The one on Key Lime was my father-in-law. Okay, he died from a glioblastoma level 5. The doctor told us it can get to the size that it was within a 6-week time period. He's one of the adults that aren't even being counted. Why? I know you're just saying that it's the children, and by God, everybody knows our kids are the most important things in our lives. But there are adults out here that are dying from it. I don't know if you've seen our website. We have a website.
If you could, please, that you would let her respond. And thank you.
And again, when we started this study, we looked at adult brain cancers too, and it did not show an elevation in the Acreage.
You said it showed, it's elevated, just not statistical significance.
Okay.
Is it elevated? Yes or no? Your data said yes.
all cancers, that means when we looked at all cancers for adults, showed some elevation that did not pan out with increases in population. The category, of course we looked at adult brain cancers. All right, let me just finish this thought, which is the sentence, which is that adult brain cancers did not show elevated in that first report. We looked at adult, we looked at pediatric, and pediatric was elevated. We looked at all cancer in adult, marginally elevated, what non-elevated after we did the population recalculations.
How many?
Are you including the death certificates? That's what I want to know. Are you including the ones that have already passed away? Or are you only including the ones that are alive today?
When the cancer registry collects cancers, it collects it from all sorts of places. It collects from the hospital, the doctor, the pathology reports, and it also sweeps death certificates. So, if cause of death was a primary brain cancer, that should be included in the registry. So, adult cancers were looked at for the period 1995 to 2007.
We gotta wait for our children to die before anything gets done. Scoot down.
Okay.
You're in 95 to 2006.
That's absolutely correct. That is posted from the phase 1 report, again, against population numbers. And then I think if you look at that, sir, also with what you're reading, it points out that there was expected about 1,000 in Palm Beach County, and that's the numbers actually that Dr. Watkins is addressing at this time. I think we're hearing you. I think everybody here is hearing you, and perhaps we do need to take another look at the adult levels of cancer as well as the... However, I want to preface that. Please, if we could. Madam, do you have a question over here? I think we have time.
Before I'm honestly really embarrassed the way everybody's acting in here tonight. I mean,
Thank you.
this is hard. I have to say, one, I've lived in the Acreage since 1980. And if you would like to start with a home as far as searching, for radiation buildup in a home, please start with mine. My house was built in 1980. I've lived in it since 1980. I drink the well water. I still drink the well water. I'm not afraid of drinking the water. I don't think it's the water. I have never heard so many people so upset to hear the health department say there are not elevated cancer rates. I mean, it seems, I really want to know, one, how many children with cancer are there that are beyond the statistic? Is it 3? And you're based, I have a list of questions, and I've listened to everybody, I've listened to the audience scream, so let me take my questions now. You've pinned us with the designation of a cancer cluster, and it has affected our community, as you can hear tonight. It has made people very angry, it's made people very upset, some because they're afraid for their children, some because they're concerned about their property values. So you can't just leave us, excuse me, it's my turn. You can't just leave us with this designation without continuing on with the studies. If there are adults, additional adults that should be included, then you need to include that. I have not heard those statistics. All I've heard you say is that they were not really beyond the norm. So if they are beyond the norm, then that needs to be included. On the population numbers, for years the county has been telling us that we have a population for purposes of land use of between 45,000 and 50. So that could skew your figures. In addition, I have always heard that residents in the Acreage have larger numbers of children than anywhere else in the county or in the country. We are prolific baby makers. So the average could be 1.5. Our average is 3.2. So it's higher than normal. We paid over $1 billion to bring Scripps to Palm Beach County. We paid over $200 million to bring Max Plum. Let them study this issue with our tax dollars that they benefited. If the county or since the health department only studies clusters when somebody asks for it, I want studies done in every other municipality to see what their rates are, instead of just picking or petting our community with a cancer cluster, especially when there's reports like I got today that say all of South Florida has a cancer cluster.
There you go.
So, I mean, we need some answers, and we need the right kind of answers, and I don't want people freaking out and thinking we're something special, you know, and that we should have cancer. I don't want them yelling at you, but I do want you giving us the information and studying what needs to be studied. Thank you.
Thank you. Lady over in the blue.
Hi, my name is Leslie. I built a house out here in 1988, and I'm addressing your timeline, your pediatric cancer timeline. There's a person missing in 1996, which is my son, who passed away from a medulloblastoma, which has been addressed. They haven't heard of one occurring out here. Well, it was here, and I'm concerned that your statistics are not accurate, because I know he's
And I would like to talk to you after so that we can exchange information, names after. So, thank you. All right.
This side.
How you doing, guys?
Am I ready?
Let's get some statistics here. Your scorecard from the EPA. This is called the scorecard, done by the EPA. Based on EPA most current correct data, this county ranked among the dirtiest and worst of the 10% of counties in the United States for air quality, as per the Clean Air Act. Let's start going with the air people. I hear all the water people. I'm looking at the air. The numbers from March 2004 was the fact that the population in the acreage was 44,763. Our elected officials are saying there's 50,000. What are the true numbers? Because if those are the numbers, then our cancer numbers are a little skewed. When I read articles in Facebook that people who didn't even live here, that their child had cancer in vitro, I'm worried about us. I want facts. When I speak before the county, the one thing they know is I ask for facts. And I get the facts. Because we have a population out here. We have people out here saying we want city water. Be careful what you ask for. Because it's going to cost us. And it's going to cost a lot. Because the Palm Beach County Water Utilities borrowed a lot of money to put water out here. So get the numbers. Because I'm wondering, if I could find the numbers for our population in March of 2004 is 44,763, where are we getting these numbers from? Please get accurate numbers. I have to agree with Patty, because I'm not afraid of my water. I'm not afraid of the soil. I'm not sticking my head in the sand. I'm not in here screaming at you. I've called Tim, God bless Tim, at the health department. Mr. Abruzzo, I called your office and tortured you yesterday. So I just want you to get accurate numbers and accurate tests and accurate scores. Do we have 50,000 or do we have none? Thank you.
Thank you.
Yes, thank you. My name's Christina. I'm glad that Michelle and Shelley are here with the Indian Trail District because, as we all know, with this designated cancer cluster, our homes are worth nothing. And Indian Trail does not need to pay millions of dollars to pave roads. Thank you, Michelle. Save our money. We can't afford it. Can't afford it. Another thing that I was upset about, and I agree with Patty, now that we're a designated cancer cluster, we won't be able to sell our homes. They're worth nothing. CBS, Channel 12 came on after the cluster was declared on 11 o'clock, and one of our greedy realtors area, got on the local TV and was interviewed in her office. It just wasn't walking down the street. And someone says, what does this do to the real estate value in the acreage? And she declared, it's devastating. Who would ever want to live in a cancer cluster? These homes will be worth half what these people pay for. And this mentality, though, and not looking at the numbers correctly, and seeing really, out of the total population, how many children are affected, how many adults are affected before we all get labeled as a cancer cluster. And that's what bothers me. Along with Indian Trail probably trying to come along with Mike and Michelle and everybody, trying to raise our taxes, get more paved roads, but homes aren't worth anything anyway. Anybody for more paved roads? No! Waste enough of our tax money, Indian Trail. Thank you.
Thank you.
My name is Deborah and
Please, quiet.
I've lived here since '95. The reason I want to know, I called the EPA and I called the DEP because after I started investigating, I noticed that since 1979, Pratt and Whitney has had numerous spills and dumps throughout the area. There's still 24 contaminants on their property. The EPA looked into it and they were going to designate it a Superfund site. And then instead of doing that, they passed it off to the DEP, who did remediation. I guess basically they have a private contractor that comes out there to see how things are going. Since then, there's been numerous spills. In 2003, that I-4 dioxide. There's been thorium dispersed nickel, which I think causes radium. Our scientists over there maybe can tell me if that causes radium. And when I looked at the tests, they didn't test for the spilled chemicals. The chemicals that were on the list, the TCE, where they had the cancer scare at Pratt and Whitney in 1980, they only tested like 16 wells for that I-4 dioxide. And did they ever test for TD nickel that causes radiation? I'm not totally sure. I called the DEP and they said no.
Yeah, can I back up a little on all of Pratt Whitney? And thank you, Ms. Sayers. I've seen your emails with Moni Tripp.
But has the health department ever done a report since 1988 when they said that materials were disposed of in the landfills, incinerated in trenches, solvents and solvent sludges, asbestos, fuels, paints, pesticide, herbicide, chemicals, garbage, sewage, sludge. Human exposure to contaminated groundwater is of concern. This site is within the 100-year floodplain. Surface water runoff and flooding may introduce contaminants to the wetlands and canals that drain the site. Uptake of contaminants by fauna exposed to surface water.
Okay.
Wind-blown dust could originate at Area C burn pit, which exhibits no vegetation.
Ms. Young.
Yes. I want to back up and do Pratt Whitney in a more general answer, knowing that...
EPA gone out there.
Please, if you would let her respond. Thank you.
Okay, so important points about Pratt Whitney, because I know there's been a lot of question and speculation as to whether there's a connection with the issues in the Acreage and Pratt Whitney. Important point number one, they are under a DEP permit for corrective action for hazardous waste cleanup, those very things that you're talking about. The reason that EPA back in the 80s said we're not going to do this under the Superfund program is because there was that ability for the state of Florida to take it on and do it in our hazardous waste program. So that's the reason for the handoff. It probably got things moving quicker
to do it with DEP doing it.
Did you know that there's been a 10-year study in New Haven, Connecticut by the Department of Health of Connecticut looking into the same brain cancers of Pratt and Whitney employees, that rare brain cancer?
Two important points that I'd love to make. One, the information that we have,
Please, if we could finish, thank you,
just let me
please.
finish. The information that we have, there are a lot of monitoring wells on this property. The contamination that is on that property has not migrated off-site with the exception of one.
Did you ever test our area when this happened? Did you ever come out and test the soil, the canals, or wells? To
One
see.
exception to contaminants being off-site is 1,4-dioxane in the Corbett Wildlife Management Area. That's the only
Did
thing
you
that
ever
is
come out to our
off-property.
area after that spill and test our water or test our canals to see if it got into our soil or our water?
That's a level of detail I would have to research for you. I do not have that information at my fingertips tonight.
Were we ever test for TCE when they had that spill?
I will tell you that our information and knowledge we have of Pratt Whitney is that it is not a direct connection to the problems of the acreage.
Have you tested people's blood to see what's in their blood, these chemicals?
How can you say that?
One of the questions that we can ask as we go forward with Department of Health is if there is any correlation with workers. We don't know who works there and how that interacts with what Department of Health has done. We intend to ask that question.
Okay. What about percolate?
Please, we all have questions.
Percolate, has that been tested?
Like, please, I don't have that level of detail with me tonight. I'd be happy to get with you.
Sir, over on this side.
Good evening, my name's Louis Sierra, and I'm one of the many concerned parents here. Please, a blue-collar guy. Okay? The question that I have, are these clusters only affect the brain, or are they affecting other organs in the body? The reason I ask that is because my 7- and 9-year-old for the last 2 years have been experiencing liver problems. And the only result my wife and I seem to get is a high hospital bill. And the other thing that I wanted to ask, are the tumors on my animals a sign of what's going on?
Yes, they are. Yes, they are.
That's the question that I have.
Okay, we're not aware of any elevation in liver problems, and I'm not aware of what would be causing elevated brain cancer and liver problems. I'm writing this down, and we can discuss this as a combination with CDC when they come next week.
It just seems pretty frustrating to us because, when we do go to the hospital and, that's the only option that we have. It seems like the doctors there keep us there for hours. They do CAT scans, MRIs, and they can't seem to pinpoint anything. And nobody's giving us any answers. It seems like when we ask the question about the issues going on here, their faces seem to drop and they don't know what to tell us.
Okay.
But that's my question for
Sir,
you.
can you repeat your name as well, please?
My name is Louis Sierra.
Lucio?
Louis Sierra.
Sierra.
Thank you very much.
And about the animal aspect of your question, we have received a number of reports or comments from you that there are illnesses in your pets. And, at this time, we don't have a way of evaluating them. I mean, we're not quite sure what that means, but we can say that sometimes animals their health does indicate some of general problems in an area where they can be exposed and have effects that are similar. So there is a veterinarian in Palm Beach County that is collecting some of those, and we're aware of them, and we plan to work on that too.
One last thing that I gotta ask, one last thing. Are there any organizations to help out people that maybe don't have the resources, the funds to get the proper testing? Because it seems like when we do call Medicaid on this kind of issue, they don't want to answer any of our questions. Are there any specific organizations that are just specifically, concerning this problem here?
I am not aware of one, but that doesn't mean that it doesn't exist. We're going to gather your information. We'll get it back to your...
Can we get your information after?
Yes, ma'am.
But we can provide that if we're able to find something to.
Thank you.
Talk to your social workers in the hospital also. They
Sir,
know.
over here with the hat, please.
Good evening.
Good evening.
Thanks very much for being here. My name is Sam Carter. My wife Diane and I are residents. I'm a girls softball coach out here at the Acreage, and we really enjoy our community, and I really appreciate the opportunity to come here and ask you. My point or comment is a slightly different direction. I'm happy to leave the scientific process to the people who know more about it than I do, and I will be monitoring that closely. I'm more interested in, as a couple of other people mentioned earlier, what exactly, sort of we can do as we're waiting for the process to play out. I, for example, tried to look into whether or not the well that was installed in my home, well before we moved into it, was installed using best practices. I understand that they shouldn't be too shallow and all that sort of thing. And I called the county, and the person was very polite, telling me that the records are too old for us to know. So I guess I'd have to go out and get that tested on my own to find out how deep my well is and whether or not it's safe and all that. But I really do want to reemphasize what other people have brought up, a list of sort of practical things, not pie in the sky. We understand the answers aren't going to be forthcoming immediately, but things like, is your well safe? Is just, things that you can look for soil. I've seen some questionable things anecdotally being, dumped out in property lots and so forth. And I'd like to just know some common sense things that I, as a homeowner, as a resident, as a parent of an 8-year-old girl, might be able to keep an eye out for and sort of assess my personal level of risk, because, I think we're all going to be here for the long term.
Anybody want to address the well and the depth issue, even possibly?
We do have on our website, we do have information about private wells, about maintenance, about well testing. Those are good, solid ideas that can be done. As the engineer had pointed out in the crowd before, the maintenance of the system, about twice a year you should do that, and an annual screening of basic biologic bacteria, and then a nitrate, good indicators for your wells. But we have that information posted on Palm Beach County Health Department.com, and if you call our office, we'll certainly give you help and guidance. That is one of the things that you can do. Understand the depth of the well is a concern. A lot of people say that they don't know the depth of the well. The only requirement for well construction, as far as depth is concerned, is that they're able to get to the zone that provides potable water to you, or serviceable water. It could be at 40 feet, it could be at 90 feet. Depends on the local geology, the layers, the marl layers that are there, and how deep. Usually we say the deeper the better, okay? But knowing the geology out in the acreage, you are faced with what they call a superficial aquifer that penetrates down approximately 900 feet. So basically, the sampling that DEP had conducted is a good, valid representation of the water source. Okay, so we start with that, but that's pretty good right now. It is a threatened water source in that it is definitely sand, chemical sand, and if you spill something on the surface, it can penetrate to the water source very easily. And so it's a threatened water source, but with good maintenance and routine, if you have a good treatment system in place and routine maintenance, the water quality there, I assure you, meets standards.
Thank you very much.
Thank you. Sir?
Good evening. My name is Kevin Halstead. I've been a resident out here for 25 years. Raised 4 children, 4 girls, ages 25, 24, 23, and 21. So I guess that woman did have something that pertained to me as far as fertilization. I've been insulted twice here in the last year. Once was when I got my tax assessment bill for $300 more for a house that's worth, like the other people stated, absolutely nothing. And the second was tonight when I received a flyer from an insurance agency. And I am very upset with this. Why would somebody at the door of a meeting for cancer cluster hand me an insurance waiver? I am very, especially in Palm Beach County School Board, they don't let anything else in and out of their schools, but they can allow something as frivolous as this. Cancer care protection. Hand it to me at the door of this facility. Now, that's one of them. I don't know where we stand on this. I don't know where we're going to go with this. I'm just up in the air, and I can tell you this. If you don't think that you people living out here are going to be affected by your job, because once they find out you live out here, your insurance company's going to drop you. I have right now a mass on my right side. Doctors told me it's a hernia. All they want to do, they ask me all the time, do you have pain? I said, no, I have no pain. You need pain pills. They ain't got no pain. It just seems like it's like the last person. Where do we go? And I don't believe it is in the water because, like I said, I raised 4 kids and we drank the water. I drink out of a garden hose. I'm an old redneck. I'm out cutting my grass. I drink out of the hose. And I don't know where, like I said, where do we go? And let's all do it together. We're here as a unified body, and I'm looking into getting a lawyer right now. And if anybody wants to get on the bandwagon, we're going to put our tax money in escrow, and we're going to hold it as ransom. Until we go further and find out what is causing this problem. And we hold on to our money. We put it in a lawyer's going to hold on to our tax money. And when the county will get our money when we get our answers. And if you want another 25 mil, go see Tony Massalotti because he's got it.
Thank you very much. I just want to reassure you, unfortunately, we were unaware they were passing that out, that flyer, and it really would not have been allowed. It's fine. I just want to apologize that it happened. We didn't endorse it. And again, take it for what it is. That's all I can say. Sort of.
Hello, my name is Mike Davis. I've been a resident out here for 20 years. Just real quickly, lady addressed possible radiation problems associated with apartment builders. I just want to let you know, I've been an industrial radiographer for 28 years. Radiation safety is my life. Okay, I'm not a big fan of what the man had to say, but one thing he did say was correct. For every 2 feet you're away from that carbon filter, your radiation dose is cut by 4 times. Inverse square law. Okay, so alpha and beta particles are probably, of all the radiation spectrum, is probably the least hazardous if you had to give it a classification. So I wouldn't think that being living or sleeping next to the carbon filter would have anything to do with it. Just my opinion. So just my 2 cents worth. On the issue of statistics, I'm a statistic. Let's see. My former spouse had a brain tumor. Fortunately, it was not cancerous. However, it was a brain tumor nevertheless. My neighbor across the street, their 14-year-old daughter died of a massive brain tumor, cancerous, diagnosed 4 months apart. Okay. I've noticed on your statistics, you said that you interview people to get background information and so forth. This family, approximately 4 months after their daughter died, moved. They could not stand living in the house that their daughter died in. I want to know, did you track people down that don't no longer live in this area, that their kids died or family members died of brain tumors, or did you just interview the people who are still currently living here? And I know you said an adult, you've been studying for the adults. My wife was 35 years old when diagnosed. She was an adult, so fortunately she lived through it. So I want to know, that slightly elevated cancer tumor for adults, anything above 0 is not tolerated. And taking accumulation with the kids, which I was directly affected, or I should say indirectly affected, by my neighbor who I was very close with, all that together one thing is bad, all of it together, we should be banging on Obama's door for this one.
Let me just say that of the 12 cases that were identified and interviewed, I believe those families, whether they moved out or not, were reached out. I think they could only not locate one family. So if they were identified and diagnosed in the Acreage, even if they moved out afterwards, every effort was made by the Palm Beach County Health Department to locate these families. They did indeed locate some of them, and I think they were unable to locate one family.
What about other tumors, though, non-cancerous tumors? Is there any statistics on that?
Non-cancerous?
Non-cancerous brain tumors.
Well, if it's classified as borderline and benign, it's in the registry as well, and those were interviewed.
My house has never been contacted, nor is it on the sheet and identified as being in that cluster.
And that's because you're talking about an adult case in your house, correct?
That's correct.
Correct.
I am a statistic.
I understand. I hear that, and I'm explaining that the interviews were done on the pediatric, but I am.
Chalk me up on the list to add adults to that list.
And I
One or both.
I do. We've heard that, and I'm addressing that with our federal partners. Thank you.
Thank you. If I could say, I think there's a lady in the end of that line and the lady on the end of this line at this point. When we get to those questions, we will have to conclude this. We're over time already, which is okay, but we need to start wrapping this up. So in deference to the people in line, that's it. Please don't jump into line more. And then the only other thing I want to bring up, there were 4 people in the other room. I don't know if you know, but they had to set up. Are they all here in line? Okay. So I just want to make sure that I had promised that they would get their questions addressed. So, okay, sir, if you would please.
Good evening. My name is Joe. I live in the Acreage now for 4 years. And I guess my question is that I've watched trucks come in and out of the Acreage dumping what I consider RSM. I know RSM. I know what's in it. You know, I called DEP. They said they're supposed to keep it back from 100 feet from any open water source, cover it within 90 days with sod, grass, whatever it might be. My question is, with everything that's going on now, I just had a neighbor dump approximately 400 tons of this crap right down the street from me. It's recovered spring material. It's glass. It's lead, copper. Well, I got a little bit of experience in it, and that's my question to you, Mary Jane. Why haven't they stopped it? Right now, out of all times, you know, there's something wrong. I don't know if it's in the air, water, soil. I have no clue. I've kept my mouth shut, but there's something more to this. I know the animals, whatever that big word is, and it's nasty. It's bad stuff. Why haven't they stopped it?
We've tried to investigate. I know what you're talking about, and we have tried to investigate each of these complaints.
Sign waivers saying that they're not going to be liable for it.
Can we talk afterwards? Because I'd love to get the information to go forward on that, because it is.
It's been said. I mean, it's like it's raked up underneath, you know, that stuff's there.
Right. As soon as we're done, please, come, let's get together and I'll
I got a daughter that's 13 years
I
old.
can tell you right now, there's a house on northwest.
They're up and down him. They're pouring all over the place. They don't grass all over. They don't do nothing. They're filling ponds with it right. I mean, how many people know this? Come on! Be honest.
We don't know who they are.
Sir, Jillian is right there with you. She's going to get your information, if you would give it to her, please, so we can run that down. Thank you. Over on this side.
Good afternoon. My name is Stephen. I built the house out here a couple of years ago, and I really enjoyed living out here with my family. But recently, I've been scratching my head, wondering what the heck I really have done. And I came in this evening and all I saw was a bunch of graphs and statistics. And the statistics, everything is saying that everything is okay. And in the science show we saw, everything is bad. So something's really wrong there. I have a suggestion. I look at the Trail saying they're seeking help. I don't know what help they're speaking about or they've been thinking about. My suggestion is Indian Trail get together with the county. The county get together with our legislatures in Tallahassee. Tallahassee get together with Obama. We have a crisis here. Wherever there's a crisis exists, we need drastic action. So my suggestion is we bring water here to start and sewage for the people. Let's start alleviating one at a time. And the people should not be paying for this. Their tax money has been exhausted years went by on this stuff here. And we should start with water and sewage, and we should not pay for this. I want that message taken to Tallahassee, from Indian Trail to the county, to Washington. Thank you.
Thank you. Sir?
Good evening, my name is James Hess. I've been in this area for just under 3 years. I have a 13-year-old daughter I'm the primary parent of. I'm a single parent, all right? I'm waiting on a phone call from my physician to let me know about a CT scan on my daughter that was just performed today, as I was rushed there with my daughter because the doctor, the physician, turned around and said it's very important that you go there. She had me in this place within an hour and 10 minutes. Okay? I'm still waiting on an answer. I have the same materials dumped across the street from me, 2.5 feet high, glass, lead, garbage, in an empty lot that a guy walked away from. Okay? My daughter has had headaches for the last 5 months. I have headaches for the last 6 months. Okay? I don't know what to do. Tell me, I mean, I'm a single father, just like a lot of other people here. They've been here longer than me. I've never had this issue. In my background, check it. I have no cancers in any side of my family. What do I do? How do I go home and look at my daughter? My daughter's scared to death. All right? I'm here wasting time away from her to get an answer. What do you got?
You're obviously doing what any parent would do, which is getting her into the doctor and trying to get her the very best diagnostic test and understand what's happening with the headaches and what's going on. Beyond that, I can't offer you advice as to what is going on next door. I'm looking to our partner DEP to maybe answer some questions about what this is. I've not heard about this dumping before.
Obviously, there's a lot of things that are going out here in this area. There's a lot of things being overlooked. I mean, somebody has to be held responsible for this stuff. Somebody has to get down to the bottom line. You all have to do everything you can and drag in as many people as you can to get answers in a swift way.
Agreed. We've heard that, and we are meeting with CDC next week. We plan to meet with them next week.
When I get a phone call tomorrow, my daughter might or may not have cancer. Is next week going to help me? Is it going to help me? Is it going to fill the void?
No, it's not.
Thank you.
I'm waiting
I
for a
agree.
phone call too.
Yeah. Tim, let me go back to the recovered screen material, just so everybody knows. When facilities take construction demolition debris and they recycle it, and the sorting and the shaping and the screening, this is the material that's left over at the end of that process, okay? Big piles of it. It is a lot of ground up glass and pieces of wood, and it's typically not that bad of stuff, but let me finish. Several years ago, we contracted with the University of Florida and said, help us analyze this, help us take a look, help us figure out what various approved uses could be. And there's certain uses that are approved. Never did we say,
that you could just do any unlimited, land application, piling up, anything that had opportunity for exposure. You could use it as cover in a landfill, you could put it under concrete and things like that. So our district office is very interested in helping investigate these dumping complaints. That was my point earlier. If afterwards you come up to me and let us know, we'll check it out, because that's not an allowed.
It's on every street, on every block, somebody has it somewhere. Everybody has it.
Okay, good, sir.
How you doing? I want to thank you for coming out here tonight to address our concerns. My name is Lyndon Sharif, and I'm one of those statistics with the cancer discovered in the last 2 years. On top of that, my son was diagnosed last summer with lymphoma cancer as well. A healthy child, no symptoms of anything, swim team, track team, and now he has cancer. So when you speak about just a little bit more of an average, or I come here and I only hear about brain cell cancer, it's kind of insulting, because you degrade my son's life and my life as well. Even though I know you have to address some type of agenda, it is degrading. So, I sat here feeling like, well, my son isn't important enough to you. The other thing I want to talk about is maybe perception, all right? There's too much time in between these meetings, and the people are feeling helpless, they're feeling scared, and they need to be able to express these feelings more directly. We have open offices like by the Winn-Dixie or so. Why can't we have some kind of center there where not only can we get information, but we can also exchange information. We can help the families that are suffering, maybe because the costs go up and we are in a recession. Maybe we could do some fundraisers together as a community and do something for these families, okay? How to protect your family more from things that will weaken them while they have the cancer, or if you think they're sick on something else. There are remedies and things that we can do to help each other. And as Jess Santa Maria always says, we have to help ourselves. We cannot depend only on the government. So my suggestion is, can we create something more direct that we can reach out and touch and feel and work with? And maybe there won't be so much hostility at these meetings if we could do something in between. Thank you.
Idea. In sitting up here, I had thoughts about how to address the disconnect, because there's obviously a huge disconnect in time, in communication, in access, in resources, in discussion, all the things that you really brought up. Whether we look at a task force that involves members of the community and us, that it can be a much more ongoing dialogue will provide more real-time information. So that's one of the notes that I had written to take back, to see how we could establish that, so that you all would not feel like the dialogue was one-sided or that it was contingent upon our schedules. It's not. It's something that we want to provide in as much real time as we can. So I think that's an excellent idea, and we will make it happen.
Let me just personally say that I personally apologize if in my discussions and when I'm talking about rates and elevation and slightly, that if I offended or made anyone feel that their particular case or their situation didn't matter. That's not the intent, my intent, and really my personal apologies. I did not mean to do that, and it's a sort of a side effect of talking statistics, but that's no excuse.
My name is Butch Dias. It was a great dog and pony show, but it didn't give people answers. I think people are more frustrated now than when they came in. I know I wanted to leave several times, and I'm a very patient man. But living in a cancer cluster is an imminent threat to public health and the health of our families. Okay, I'm a dad. I got a great wife, 4 kids. They're all losing their hair. They're losing their teeth. My wife has had cancer. I've gone to 20 doctors for my wife, and you know what? They said, we don't know what the answer is. They said, one day, she's got lupus, next day she's got this, next day she's getting worse and worse and worse. Okay, when we started getting this cancer cluster, we shared some of the information that we saw to our doctors. They said, you know what? This could be what it's doing. So we had a water tester. And I kept hearing people like, it's not the water, it's not the water, it's not the water. Well, guess what? Ours came up bad. You know what they told us to do? Don't use your water. Don't take it. Don't take any showers. Don't breathe it. And our clothes are coming back. They're dissipating. I went to use a shower the other day, and the towel was just falling apart because we're washing in this water. My 16-year-old daughter, she's gorgeous, beautiful jet black hair. She gave me Christ. My hair's falling out. You know where she sleeps? Right next to the water system is her room. She's had massive headaches and all kinds of problems. So you know the first thing that they said, move her away from there. We took the information that we had, and there were only one family. And from what we found out, just taking a water sample, they told us you better leave. You know what? Because the governor's not going to give you anything. You know, they're going to keep going, testing. You know what? They told my wife she may have six years to live. My little son, who was born here, blind one eye, had a tumor. He's only 8 years old. He's crying, he's saying, Daddy, we're going to die here. Mother God is scared. My son, he says, you know what? I'm in Operate at college. You know what? We got great water. I'm feeling better this last 6 months being away from this area. He says, you guys got to move. He goes, what are you going to lose? Your house is worth nothing. You poured your life into it. What's more important? Our family or the stupid house? You know? What am I going to do? I didn't get any answers. You know? And you know what? All I had to do was test my water. And you know what? They said, hey, don't use your water system. They told me, don't open it up, because what happens when you open it up, you're going to get all this stuff on you. Yeah? What do you do to service your water? I'm going to leave it there. How long is it going to take to get city water? Guess what? Yeah. By the time we go through all the testing, my family's going to be dead. You know? So, I mean, I didn't get any answers. Okay, thank you.
Thank you. Again, I want to reiterate, I noticed a couple people joined the line, so we had asked those people in line earlier, the late ma'am, there's a woman behind you in the beige or aqua, we're on the other side, I think. So we are going to cut it off. Robin, on your side, there are 3 people. And, no, not 4, 3. And on that side, there's a gentleman in a suit down, that's kind of what I used as a marker, so. And there was a lady with it right next to me. Yeah.
I get brain dogs for a half hour waiting to get in this place.
Yeah. I was out there 2 hours. It was the people in line. We're just trying to accommodate everybody as much as we can.
Accommodate them.
You would go ahead.
Tim.
Oh, I'm sorry.
Tim.
Oh, sorry.
Tim. We're willing to stay for as long as they have questions, as long, I don't know the parameters on the use of the auditorium, but we're willing.
Okay, the only thing I can do is check with the school.
Okay.
We pay for the school.
I understand. We're willing to stay as long as
Can we get on with the meeting?
Settled issue if we could, please. Ma'am, I'm sorry. Over here. Sorry, I'm going back this way.
My name is Octavio Martinez. I live out here in the Acreage. In the year 2003, I began the process. I brought my family out here, and I began the process of building our home. Every morning, I would frequent the restaurant in Royal Palm Beach, a Spanish restaurant, and I would have coffee there. And through being there, after a certain period of time, I met the owner of one of the local funeral homes, one of the owners. And And we became friends, and we would chit-chat every morning around keeping coffee at the place. And he asked me what I was doing here, and I told him I was building a home. And he says to me, and I'll never forget this, he says, you know what, can I give you some advice? He says, I've been in the funeral business all my life. And he says, I have never seen anything like what I'm seeing, and the people that I'm burying out of that particular area here in Waxahachie. I have his name. I said to him, what are you doing about it? He said, I sent a letter to the governor. I sent a letter to Masalati. He says, no one responded to me. No one really seemed to care. Now recently, today, I got the bad news that a friend of mine who lives out here in the Acreage died last week of lung cancer within a 30-day period of time. It was diagnosed 30 days ago. He was buried on Tuesday of last week. And it's just, I was in denial for the longest time. I've seen it with friends, dogs, brain tumors, cancers with the animals. My friend that recently died. And then one of the owners of the funeral home who warned me about living out here in the year 2003 and who wrote letters to the authorities, and they never responded to him, or if they did respond, it was just once, you know, the general, typical, standard letter that comes from our politicians. Secondly, you know, our properties are basically worthless. Last year, the politicians that are here today voted to raise our property taxes on the cancer cluster community that we live in today. My question to them is, will they continue to raise our property taxes this coming year? Thank you.
Thank you.